So today we're going to talk about one of your favorite topics, innovation, nursing innovation. What is a change agent?
So a change agent is someone who really identifies a problem or an issue or an opportunity and then takes that opportunity forward. And they can do it in a lot of different ways, on a local level, in their unit, perhaps on their shift, or just with that one patient. But they can also scale their change across the unit, across the division. And we've seen nurses who actually take their change idea and scale it across the hospital system to affect patient outcomes as well as fiscal outcomes for the organization.
How can a nurse be a change agent?
Nurses, they're at the front line of patient care. They're right there where all the action happens. Sometimes, though, they don't have the voice to take that change forward or propel their ideas. Or sometimes, which just drives me nuts, they say, I'm just a nurse. I couldn't do this, I'm just a nurse. And I say, you're a nurse, you can do this.
What are some specific examples that you have seen that nurses have created?
The staff nurses who have participated in the CSI Academy, they have focused on never events, which are events that shouldn't occur in a hospital, so things like falls or pressure injury. They've focused on early mobility, getting patients out of bed. For a time, there was a belief that if a patient was ventilated or intubated and ventilated, that they shouldn't get out of bed and move. They have focused on the hospital-acquired conditions, so CLABSI, CAUTI, just endless of those. And most recently, the nurses have started focusing on communication issues. So communication not only with the patients and the families, how can we communicate better with them so that they can be partners in their care to have positive outcomes, but also communication within the team or with their colleagues, their nursing colleagues. So some of the teams have focused on handoff. How do we hand off? How do we talk about the patient I've cared for to the next nurse or to the next healthcare provider that's taking care of them? And they've also focused on communication within the hospital. So how do we receive information within the team? So one team in particular looked at nurse-led rounds. How do I participate in the hospital rounds where we're talking about the patient and what our next steps are with that patient and our care goals and what outcomes are we trying to achieve? And with nurses participating in that, it seems intuitive that they should be there, but they're not always there. And so this team took the initiative to lead that round and to have other healthcare partners involved. All of these are common problems. It's not just nurses that participated in the CSI Academy. They can be found in hospitals across the United States. There's opportunity for them to take that problem, they identify the problem, and then they make their plan of how to affect the change and carry it out through various parts of the curriculum. So in the curriculum, we talk to them about social entrepreneurship and how that can help you move a change project forward. You know, change is hard.
Yes.
And it takes a long time. And the CSIs who've completed the program will tell you it's a lot of work, but it's joy for them. It's good work for them because patients are at the heart of what nurses do. And I like to say nurses were the original MacGyver. I don't know if you know
Yes.
that TV show,
Yes.
but
Yes.
you know, he could take nothing and make something out of it. And I truly believe that about nurses, that when they're given the opportunity and they're given the support and sometimes the skills, you know, nurses in our program, they don't always know about some of the concepts that we cover in the program. And so helping them, giving that little bit of education and then being there to support them and applying that education, the outcomes that they can achieve are just phenomenal.
Any challenges in getting a buy-in from the institution or wherever they're trying to affect that change?
A Greek philosopher a long, long time ago said change is constant, and that is really true in healthcare today. I think it's important that change is from the bottom up and not from top down in an organization,
Right.
because nurses do know the innovation and they know they have ideas and solutions, but they're afraid to talk about them and enact them. Participating through the CSI Academy, we go through various topics of change and give them the tools to be able to do that. And some of the things that they focus on are communication. It's very important to have your 15-second elevator speech. And you need an elevator speech for a lot of the different people that you encounter. The patients and families might say, why are you getting me out of bed? I'm intubated. Or the patient wouldn't say that, but the family would say that. And so you need an elevator speech for them. And then your team members who are saying, oh my gosh, do you know how much work it is to get that patient out of bed? Why should I do that? You need an elevator speech for them. And then perhaps the nurses need some additional equipment. And so they need to make the business case for, we need some additional equipment and here's what we're going to do with it. So while we might spend, I don't know, I'm just estimating $60 on a walker to help us get a patient up, in the end, we're going to decrease some of the complications in the ICU or the length of stay, and we're ultimately going to save the hospital $1,000.
Right.
Now, I'm just
Right.
ballparking figures. We're not anywhere close in the ballpark, but we help them with creating that business case to talk about what's a return on investment. It's surprising to me that some nurses don't know the costs of things in the hospital. Nurses are very cost conscious and they want to save money for the patients as well as the organization.
Mm-hmm.
And they have a lot of ideas on how to do that. So they just need some help to move their ideas forward. Some of them are fearful of, well, there's nurses who have worked here for 20 years. And, they said it'll never work, or we've tried that and it didn't work. And so there are some barriers sometimes that they face. A true innovator, though, they can see the vision, they can see the end in sight, and we help them learn change theory to help move their idea forward.
What would you say is the best skill that you teach them in CSI?
Communication is key. Communication is at the heart of everything that we do. Nurses communicate with their patients, their families, their other healthcare team members. Communication is key for their project to help other people understand it and get them on board. So I think that's probably one of the biggest topics, the most important topics that we talk about. The literature is clear that patient errors that occur typically surround communication errors. So I do think communication is probably one of the most important topics.
I would think, that would go along with that with communication. It's sometimes so somebody else knows it. It's not that they're against your dream, they don't understand.
Right.
And then they have that aha moment and say, oh, is that what you're talking about?
I heard in a session earlier that whenever you put patient safety first or put patients first, that you get people on board.
Yes.
So you have to help them see the vision. They don't always have the vision that you have, and so you have to be able to clearly articulate that and have a plan, a strategy, a roadmap of how you're going to get there.
Right.
So one of the things that one of the other topics that we teach the nurses is creating a logic model, which is kind of their roadmap, their plan of here's what we're going to need, here's what we're going to do. They identify their purpose and goals on that piece of paper, as well as what outcomes they're trying to achieve. And so we help them identify short-term, intermediate, and ultimately long-term outcomes. We advocate for them every meeting that they meet with their team to bring that out and look at it and review, where are we? Where are we going next? And it's kind of a living document, but it helps drive the process.
How do you think that nurses can use innovation to create some business opportunities that would benefit patients?
Being a nurse, the opportunities, as you suggested, are endless. It's not just one aspect of the profession. There are many different ways that you can practice as a nurse, not only in the healthcare profession, but in other professions as well. And collaborating with them to help make healthcare better for everyone. And so I think that nurses do bring that. They bring that lens of creating the innovation. And I think once they become the innovators and the change agents, one of the things that goes along with that is creating the business case. And when they create the business case and talk about the return on investment, then that propels the initiative forward, and it does sometimes turn into a different opportunity. So the example I can make is with CSI, some of our nurses have taken the skills that they've learned. How do I make a business case? How do I use social entrepreneurship to propel an idea forward? And they completed their CSI project, and then they went on to use those tools to work on other projects. So one of the nurses became a rapid response nurse, and that's a nurse who responds to a call from another nurse. It's kind of like a consult. I'm worried about my patient. Can you come help me problem solve with this patient? And so it's a senior nurse. So she used all these tools to create her return on investment, to advocate, to go through the change process through her logic model. She took it to leadership and it was approved. And so now those nurses in that organization are doing that. Another example that's non-clinical is a CSI at another organization used her skills to say that, non-productive time is important. It shouldn't be called non-productive because we're very productive when we're working in meetings and committees and things like that. And so she saw the value of shared governance, and she created a shared governance council for her unit. And then she advocated to the nursing leaders by, again, creating the business case, creating her logic model, and then her elevator speech. She was able to show, by you giving us this non-productive time, here are the outcomes that we've been able to achieve. And it has expanded in their organization.
Well, and it sounds like, with CSI, that they are learning a new way of thinking.
I think one of the most innovative groups is a group out of Boston. Several of the hospitals were focusing on the problem of delirium in patients. And they were very successful in their project. And they paused and they said, it's great that we've been successful in our unit, so we're going to spread this through our organization. But what about through the city of Boston? As you know, there's many hospitals there. There are competing hospitals. And so these CSIs went at these 7 different organizations, went to their chief nursing officers, and they advocated to form a collaborative that transpires across the city, where these nurses are collaborating to educate on the concept of delirium, as well as approach it in a consistent manner in an effort to decrease delirium, decrease benzodiazepam use, which ultimately will decrease length of stay. So this is huge because they, as I say, are sharing data agreements across organizations. So we look forward to what their outcomes are going to be. They are moving right along and beginning to implement that project.
Well, I just want to thank you for coming. It sounds very exciting.
It is very exciting
You
to see staff nurses doing all this wonderful patient outcomes. The good that they are doing is just phenomenal.